Hey everybody, this is Dr. Kevin McGovern. This is the 20th episode of the Velocity RX podcast with my partner Clay Hammonds. Today, show is about pre-testing. Like, how do you know your kid is ready to get back on the field, back on the mound, between seasons, after an injury? We're going to take a deep dive into that today. But first, like and subscribe to this podcast. It helps the channel grow, and we appreciate it. So, good morning, Clay. It looks very sunny there in hot Atlanta.
Good morning. Yeah, well, it's not so hot right now. We've got a little cold snap that blew down, so
Well,
it's nice outside.
we're getting rain for the first time. Apparently, we're 7 inches under where we should be here in Boston, and we have forest fires. So this is yeah, which
No
never,
bueno.
never, which never happened. So the air quality's been pretty bad. But so, um, you and I are unique in that we work with pitchers. We also have fancy letters after our names, right? So we each of us went to school long enough to be a doctorate in the field of physical therapy, which includes the whole gamut, kinesiology, neurology, functional anatomy, the whole kit and caboodle. So I think we have certainly a leg up on some of these gurus out there. But some of these gurus out there are offering testing. I haven't really taken a deep dive into that. Um, there was an article recently that someone just sent me that it was in Houston. The Houston's travel ball is a boom, right? Boom, but it has an ugly dark side, and that dark side was a ton of arm injuries. And they had interviewed people, and it's the same thing. Well, we have this lab that we're, showing, the breakdown of the pitcher's mechanics, but nowhere in the whole article was, well, then we need to take that information and do the following to fix it. So there's a lot of people measuring things, I guess, because you can measure things, but there's definitely a gap between measuring and fixing, correcting, improving. What say you?
Yeah, for sure. And like, what are they measuring? Do you know?
It was just, of course, what parents like, fancy lights. So they had the picture where you're able to see the skeleton of the lines of him. So I don't know what software they're using. The same, there's a few of them out there. There's Kinetrax. But to me, until we have a pitching avatar of best practices, it's all for naught. So you can take that information and actually figure out what's weak, what's strong, what's not moving, what's stuck, and fix it.
Right.
And I think that's best done by physical therapists.
Yeah, for sure. I mean, just a simple, thorough examination. Physical exam, range of motion assessment being the start. How's your range of motion of your shoulder, your elbow? Not just classical range of motion, but accessory as well. Are you lax, right, or are you tight? Do we need to go get range of motion, or do we need to stabilize the range of motion that you have? Especially at the shoulder joint, I think that's huge. And then as well as the spine. I'm a huge spine guy, and so how's your T spine moving? How's your lumbar spine moving? Um, how's your hip internal external rotation? How's your ankle dorsiflexion? How's your great toe extension? These are all things that need needs to be assessed so that we can make sure that we're not putting improper stress on the throwing arm. And if you're not getting that done and you're just looking at the Kinetrax and whatever it is and looking at the radar gun, then you're not setting yourself up for success in terms of injury prevention.
So if, your average high school age kid came into you,
Mhm.
um, we can kind of go back and forth here, but what would you give me your first kind of steps? What would you do?
Yeah, my first steps is just simple range of motion assessment, both classical and accessory. Of like I said, just go up the chain. I want to look at how's your great toe extension, how's your dorsiflexion, how's your hip internal external rotation, what's your spine moving like in terms of extension and rotation. Those are the two big things I look at in spine, both in lumbar and in thoracic cervical. First rib mobility, want to see how that's doing. I want to do a soft tissue assessment for trigger points, see scalenes, upper trap, cuff musculature, supraspinatus, infraspinatus, all that sort of thing. And go and assess and see, hey, do you have any tenderness there at the UCL as well already, right? It could just be there and you not know. It could be latent and just we don't know about it. Pronator muscle as well is a big one that I like to look at. And then do a good strength assessment. How's the strength? How's the strength of your shoulder? How's the strength of your forearm? Can you perform a functional squat? Can you balance on one leg functionally without falling for greater than 30 seconds? Those are
Probably not.
probably not, and those are the things that, especially in young pitchers and even older pitchers too, that aren't trained well enough, in my opinion. And then how's your scapulohumeral rhythm? Are you able to to get good activation of the upward rotators of the scapula so that you can clear the shoulder joint, right? So that you can clear that. And most people can. And that's where they get the shoulder impingement that's, coming in. And so that's generally the things that I like to look at on day one. And from then we can say, okay, now we've got this to work on. We've got this to work on. We got this to work on. How are we going to set the plan to do that, to set you up for success in terms of injury prevention?
Excellent. So speaking of scapulohumeral rhythm, I've got some. So I very similar, take essentially an approach that they're essentially a patient without like an acute injury, right? And we're going to go through the whole body. So, even before there's, like past medical history. I mean, I've got like a specific baseball type of questionnaire that they fill out.
Mhm.
So I believe, and I think you're there on the same page too, that the body is designed to move. Injury is a movement problem, and the fix is a movement solution, right? And we got to correct those in brass tacks and taking it all away. So usually before I go into specific joints, I'll look grossly, right? So I've got a test game, which stands for Graded Active Movement Exam, that first started in my PT practice as a fight against insurance companies 25 years ago who would not pay, and let's be honest, still don't pay for proper care, right? Like if you had full range of motion and strength, they would cut you off, but that doesn't mean that you can, go down the stairs correctly. Like it wasn't functional, right? So, and there were a couple tests out there, the functional movement screen, but nothing that I found that could be everybody. That could be grandma and LeBron James, right? And what I found is that everyone has um, the neurological sequence of movement in common, and that is an equation that is really the same for everybody, right? An athlete might do it at a significantly higher and powerful level, but you still have to move A to B to C to D, right? So, like you just talked about the scapular humeral rhythm, which is a vital test. I see it, and you see it. We see the M, the T, these arm positions that are over accentuating the upper traps. And all this young lady here is not a pitcher, but here is essentially the test where you're in the anatomical position, being up straight, palms to the wall, and you're kind of doing a jumping jack. Now I'm looking, if you just on TV land there want to focus on her tank top, you will see that tank top come together right there. Okay. Now, I think this one's a close up here, so we're going to see. Oh, it is. So what does that mean? Well, you can see right there that her shoulder blade went up to opposite ear. So this person has violated the scapulohumeral rhythm where this shoulder blade needs to turn down into the vertebrae. So this would be a failed test. And I will say with pretty full confidence that all the professional, high school, college athletes that I have seen, no one has ever passed that test. Olympic athletes, Bellator, WWE, whoever, no one has passed that test. Um, we are just so upper trap dominant, right? And then, of course, once that happened, like you just mentioned a couple things. You mentioned shoulder mobility. So if someone, so right away, right, when I see this, I know that they're going to have poor shoulder mobility. They're probably going to have poor thoracic mobility with some rib that might be out, probably some alignment issue of the thoracic spine. Um, they're going to be susceptible to thoracic outlet syndrome, which would be our friend the first rib, and Tommy John by just because the kinetic chain is messed up. So from that one test, that could lead me into a bunch of directions. And the cool thing is, parents could see it, right? You can say like you know because they're the ones at the end of the day that you're going to have to convince, right? And then usually from that, I will do like some scapular depression exercises, and then well, first right after this, I would test their strength, and of course they would have nothing, and then I would do some scapular depression exercises, and they would have an immediate return in strength, and that's usually like sold,
Right.
you know, because I think you have to do when examining test, retest, test, retest, you've got to put something in there to improve their during the exam to improve their condition.
For sure. Yeah, I think that's really important for the athlete to see or the parent to see. Can I? Okay, can we see the fault, and then can I do something really simple to make that fault better? Oh wow, yeah, all right, this feels a lot better. Okay, that's just the tip of the iceberg.
Hmm.
Um, and then we can set up a really good plan from there, and then go down the chain. Like I said, we want to assess the functional squat, and balance is huge and a big one that I think a lot of people miss.
Oh yeah, balance. There are so many people who can't, at leg lift, right? They can't um keep their foot centered and they go and get all their weight to their pinky toe. Once they do that, they're toast. So I'm actually looking for a video that you're gonna oh, here we go. So you talked about squat. Okay. So um you can see that right, this hitter. So this kid is kind of like a Eastern Massachusetts legend, played at Franklin Pierce, played in the pros a little bit. So just looking at his stance here, okay, so he was having problems. He'd roll the ball to third base, and all of his power when he hit it was to right field. And you're going to see that in a second because this young man, he's out of college. I think at this point this is a few years ago. He's, double A, somewhere in there, right? So you could look at both feet, right? So his front foot, he's got all his weight in his pinky toe, and his back foot, he's got all his weight in his pinky toe. He has zero chance of hitting this baseball with any kind of power. Caved in both knees, okay?
A lot of valgus there.
A lot of valgus, and he literally obliterated my squat test and my crane test, which means like Karate Kid, couldn't stand on one foot. So how does functional testing, not, we don't just do pictures, but how does functional testing parlay into movement? Well, the body here has done a bunch of things. Now, if you YouTube people want to take a deep dive into, I forget the year when Alex Rodriguez went out with a hip injury and came back and then couldn't hit, right? It's not that he couldn't identify the ball, it's that his back foot looked like this. And I tried every connection I could to get to the Yankees because I guaranteed, would have failed my squat test. And when your foot is in this position, it has to reroute itself. And just like what I'm going to show here, him hitting, Alex Rodriguez was late. So this is just a dry swing, right? But as we move him, and he moves, so now he shifts back more on the pinky toe, knee over the toe, strides, and he's powerful right about there, right? You'd say, right? That's where the blur of the bat is, and that's right over the second baseman's head. And then when he gets out where he should contact the ball, he's got nothing, literally nothing out here, and he rolls the ball to third base. Has nothing to do with his vision, has nothing to do with his ability to hit. To me, it has to do with his ability to move correctly.
Yeah, and that was really affecting his load too, or you could, where
100%.
where you could see him going back instead of gathering down, and he was getting a lot of excessive head movement as well.
Yep. And the same thing is with, the same thing is with pitching. If you're, I see kids, their foot will wobble. So what do you do on the mechanic end? What are you looking for on that end
On the mechanic end
of pitching? Like, so if you bring someone through a physical exam, what do you do on the mechanic end?
yeah, well, first I just like to look at their squat. I think that's really important and conducive, and then balance as well. But then when I'm really looking at, okay, let's go do some dry throws or a towel drill or whatever. Just if you're not in any pain, let's throw a baseball and look at mechanics. Um, I want to look and see, are you more of a terrestrial style pitcher, which I think is the way to go, right? Where we're kind of loading into that back hip a little more than more of an aerial kind of tall and fall guy. Um, and then I want to see how well your spine moves in terms of hip shoulder separation, when that is in terms of timing, and then really big is where's your elbow in relation to your shoulder when we're releasing the ball. I see, especially in youth players, that their elbow is below shoulder level when it comes to ball release, and I think that really translates to them not having good scapulohumeral rhythm and not being able to elevate their arm without it getting impinged. And so it feels better to have it low versus in an impinged spot, right?
Right. So there
And
you go, folks. There's two tests, the squat and the shoulder coordination, that have huge effects down the chain on movement on both pitching and hitting. If you can't move correctly, you can't be an athlete, right? I mean, if you don't have you can't build the building in sand, right? It has to have a functional base. So, so let's see. I mean, you know, my normal kid is failing the squat test. He's failing. I mean, I really, of the 6 or 8 tests that I usually do, I mean, usually after two, it's like, all right, I've got a complete picture of what's going on here. I might as well, just take the dry erase board and wipe everything and redo. So someone is like essentially doesn't squat well. What are you doing?
well, it's usually one of two things. Either we're not keeping a good lumbar lordosis and we're losing that a lot, early on, or
People teach to get rid of your lordosis, right? They literally teach a pelvic tilt and squatting, which, by the way, folks, is the absolute worst thing you could possibly do. The spine has 3 curves in it for a freaking reason.
yeah, that's not a very in terms of pitching. I like to have a more extended spine, until we get into more deeper flexion during
Mhm.
our decel phase. But and then I really like to look at how are your glutes activating in terms of, are you having a lot of valgus, your knees pointing in, like if you had headlights on your kneecaps, we don't want to see those headlights cross, right? We want to see them straight out. Um, so when I see that, and somebody that's, I get some knee pain from time to time, well, it's not coming from your knee, it's coming from your hip, right? We're not activating our glutes well enough. And so those are the two big things that I like to look at through the squat test.
Yeah, same thing here. And then, when I'm correcting that, the biggest, everybody wants to lose that lordosis, especially on the negative or the deceleration. I mean,
Right.
there are so many deceleratory injuries that are occurring because of that loss of lordosis. And listen, I don't want to blow our horn. I don't. You've heard us talk about that countless times on this program. I don't see I see the radar gun light up when people do flips and stuff. I don't see anyone talking about keeping lordosis or decreasing the amount of upper trap involvement in overhand throwing. I just,
Yeah.
and if someone could show it to me, I'd appreciate it, but I don't see that. Now, what are you doing for upper extremities?
In terms of
Yeah,
functional,
just movement correction, strengthening, promoting good sequence of movement. Because, every kid's going to grab their J band and they're going to do,
right?
things like this, right? Disco, or actually, wait, I have a new thing. Ready? They're going to do this, right? They're going to do the Trump. They're going to do the Trump dance, right?
Yeah.
With the bands.
If it's somebody that's, well, first of all, I will screen the spine.
Mm-hmm.
And if there's any corrections that need to be made there through manipulation, mobilization, typically they don't have thoracic or lumbar extension, which is not going to allow you to rotate well, and could possibly lead to shoulder impingement syndrome. So I like to make those spinal corrections first, and then see how that can affect your slot, right? So then
Mm-hmm.
can you elevate your arm now without pain? Yeah, okay, cool, right? If you're having a disruption with the scapulohumeral rhythm, I'll typically work a lot of shoulder depression exercise, either prone or kind of semi prone, laying on a bench, just getting down low first. Okay, once we master that, now let's go to shoulder height and then get it above, right? And then once we can get it above with you pain free and you're strong and you're able to maintain scapulohumeral rhythm, and then we'll go into some more perturbation type activities, maybe incorporate balance with that as well, so it's more functional. I think, for me, I like to be sure that we, strengthen first, right? Okay, strength is good and power movements are good, but it's not functional,
Mm-hmm.
right? And so then once you can do that well, okay, now I want to see you do that functional, right?
Mm-hmm.
Maybe on one leg, and we're doing perturbations, and we're going down in a pitching sequence and seeing if you can still maintain that scapulohumeral rhythm. So that's kind of my approach, and I think once you start to marry together the strengthening and the functional aspect of it, that's when the big aha moment for the athlete comes in, and they go, "Oh, well, this now makes sense." Right? And then that's where they see. Um, I think the biggest benefit is when you can start marrying those together, and you're not just pounding strength exercises, which are good, right?
Right.
I mean, we want to do those, but then we want to start marrying those together with a more functional sequence, especially for pitchers.
So now, one thing that sets us apart of anyone, I guess, well, us and chiropractors, anyone on the planet when teaching pitching, is the use of these, right? Our hands. What, if any, mobilizations, manipulations are you doing, manual techniques to the pitcher?
Lots of spine.
Yeah.
In terms of the upper extremity, I may do some shoulder mobs if they're tight. A lot of times, I find that they're more lax, and I want to stabilize the shoulder joint. But if there's a limitation there, we'll do some soft tissue mobilization. We'll do some joint mobilization on the shoulder, whether it's P to A to P, inferior glides, whatever needs to happen. Do those. I don't see a lot of restriction at the elbow. Very rarely will I do some elbow mobs. Do more at the wrist. Some find limited extension there at the wrist, and but yeah, that's about it. But my big thing in terms of mobilization manipulation typically comes from the spine. I'll do a lot less on the upper extremity. If, and if it is, it's probably at the shoulder joint.
Yeah, so my top three, I usually start at the feet. The feet are taking the brunt of deceleration. Very, not very, or very infrequently, I will see someone who has good subtalar motion, right? They're always locked, kind of inversion. I rarely see someone who has anywhere close to 20 degrees of eversion in their foot, right? So I'll do that. I'll clear the SI joint. Sometimes that's not moving well. I'll also see that L5 is kind of protruded backwards, especially in kids today who are sitting all day playing video games, carrying around huge backpacks, right? Doing poor squats and poor deadlifts, right? That L5 will start to translate, and then all bad things will happen from there. And then, you know, kind of a mid-thoracic, lower cervical, and first rib mobilization. Those usually, and it's funny, like you'll do that, and the kid will be like, "Oh my God, I can move my arms," right?
Right.
It's so,
Yeah.
it's so, it's so important to do something and test and retest or show right after that they'll see
Right.
an immediate gains. And you know, whether you work with Clay and I, there's just so much more benefit going to a medical or a physical therapist who handles baseball than your typical layman. It's just we have many more tools in our toolbox that we can use because at the end of the day, you certainly will come to us to rebuild injury. Imagine what we can do to someone who's healthy, right?
To prevent injury.
To prevent injury.
That's, something in our country that's not really big in terms of, preventing. But I think especially now with what we have going on in baseball and the arm injuries, that needs to be the emphasis.
Absolutely.
How do we prevent your shoulder from tearing or your elbow from tearing?
Yep.
And
100%.
that's not just working on the shoulder and elbow. We need to look at the whole chain, starting from the ground up, especially the spine as well. And but yeah, to your point, man, it's so funny that I'm treating a kid with elbow pain or shoulder pain, and I go, okay, let me look at the spine. The spine, yeah, look at the spine, and you do a thoracic, you know, manipulation or a rib manipulation, and I go, okay, now raise your arm. Oh man, that's so much better. Yeah, we didn't treat your shoulder, right? But we
Well,
got your, we got your spine moving better. Now here's some exercises to keep it that way. All right, this is what I want you to do until I say
I
it
mean,
again. And
rib mobility, there's so much goes
yeah,
into that spine. I mean, your spine is always moving. You're breathing, it's always moving. Your ribs are doing this kind of pump handle effect. Yeah. All right. Well, we can kind of stop there and go into a little situation. So last podcast we had someone who was going to accept our challenge and come on, and they no-showed, and then a week later they said, "Oh, I never got the invite," and I pasted the invite into the messenger and then all of his feed, and we haven't heard from that physician's assistant since. But the podcast is out outlining his position and our position. But recently, I had posted a video of a kid doing a towel drill, nice fluid motion, landing, not falling off the mound, landing in a squat, jumping onto a box, jumping off, and I had talked about that. I stole your thing that the arm is the caboose and we generate power from the core. And this quote unquote coach put in there that it was all wrong. Now, most times when people do that, it was all wrong, moron, it was all wrong, idiot. So he didn't do that, but he refused, and his name is Todd Meyer, refused to say why it was wrong. So I look at that like, well, you just took a personal attack at my thing. So my audience is like, well, maybe he's not right. And of course, you can't back it up. And then, of course, they go, and you saw the chain. Well, you know, he didn't, you don't want to debate. Well, of course I want to debate, but you can't say something's wrong and then come up with nothing. Nothing. So we had a rather heated phone conversation. I begged him to come on the podcast. He did not. So from that, we are going to start I'm going to get a form somewhere on my social media that if you want to come on and talk or challenge, whether that's friendly or angry, I don't care. You'll fill out this form and we'll get you on the show. So one of the things he kept going was he was this coach for a million years and he had all these pros. And I used to treat pros, but as you know, Clay, if you stick in the pro game and you're not actually being paid by the organization, you will starve because they don't pay. Parents pay. So I just, I wasn't giving him the satisfaction of a list. So I'm gonna give Well, just a little list. We'll start back in the 1997 sixth and seventh pick overall. Dan Riker and Jeff Getz were clients of mine. Atlanta Braves, Terrell Wade, Kevin McGlinchey, Boston Red Sox, Lenny DiNardo, Detroit Tiger, Dan Schlereth. So just to name a couple of pros. Number one draft pick in Massachusetts, Jeff Allison, who then played for me after professional baseball in a summer league. So, yes, Todd, I have treated pros, but I focus on high school athletes now and middle school. But you're still welcome to come on if you get done cleaning your carpets.
Yeah, I would love to hear the take
Well, he
about
said he
treating the
would
body
not
wrong.
he would not answer when the arm moved in the kinematic sequence. His only response was, "It's the mindset of the pitcher." Yeah, that's what he said.
Which is a big aspect of the game, but
Huge aspect.
that has
Nothing to do with my post.
with movement.
Zero to do with my post. But he's certainly welcome to come on. But again, thanks for listening. Please click our likes and like this podcast, and we appreciate it. We know people are listening. I actually got a few calls over the weekend from people that one guy took our podcast on the golf course. I mean, that's some
Man,
yeah, right. So, but he said it's informative, so we'll keep bringing. And if anyone has any topics too that they want to hear about, by all means, we're always looking for ideas. Please put that in one of our chats. Hey, I'd like to know more about great toe extension or whatever it is. We'll certainly talk about it.
for sure. That'd be great.
All right. Thanks, everybody.
Thanks, guys. Bye.